Well, the number of opioid-related deaths fell in Massachusetts by 8% from 2016 to 2017. Close to 2,000 people died from overdoses last year. A recent spike in both non-fatal and fatal overdoses in western Massachusetts prompted health officials at Baystate Medical Center to alert police of the situation, which in turn led to the arrests of 3 people allegedly involved in the local distribution ring. Carolee McGrath sat down with Hampden District Attorney Anthony Gulluni, as well as Dr. Gerald Beltran and Dr. Peter Friedmann of Baystate to learn more about both the case and the lethal batch of heroin blamed for the deaths of the 3 people.
In the middle of March, we became aware of a spike in non-fatal and fatal overdoses in Ludlow and Agawam, eastern part of Hampden County. And of course, it was a major concern to us. We were becoming aware based on the fatal overdoses that were reported to my office. And then in conjunction with that, almost simultaneous, was a call from Baystate Health and Dr. Beltran in particular, who was aware of multiple overdoses presenting to the hospital. And he made us aware that, hey, there's a problem here. There's a very lethal strain of heroin or fentanyl in this region in the county. So the state police officers, detectives assigned to my office responded with a very focused investigation in the middle of March, and over the course of just a couple of days, they were able to identify the distributors and the next level of distributors involved in this particular strain of what we believe was a fentanyl mix, predominantly fentanyl. And that investigation, just over the course of 48 or 72 hours, resulted in 5 arrests and really stemmed the tide of what was surely going to be more overdoses and more fatal overdoses in particular. So it was really life-saving measures to the credit of Dr. Beltran and the state police detectives in my office, making sure that we responded quickly with a focused, acute investigation to make sure that we saved lives.
And can you talk a little bit about the fentanyl? Because you hear, about heroin, but now it seems like fentanyl is in everything that seems to be out there. How powerful is it?
So fentanyl is more potent than the heroin that's out there. Some estimates that it's 50 times more powerful. So it can really have a very dramatic effect on the patients. We're seeing it both in the pre-hospital environment, meaning the first responders, ambulance, the police, EMS, et cetera. And we're seeing that the patients tend to be much more sick that are using this because those folks tend to go out very quickly. They may stop breathing, and then they have to do the interventions that, for instance, giving certain medicines that allow them to breathe again.
How about Narcan? How effective is Narcan in these cases?
Narcan works, but it requires higher doses or sometimes may require multiple doses to be effective. So in the emergency department, we may do anywhere from 0.4 milligrams to 1 milligram. But we may end up giving 30 to 40 milligrams. So that's almost anywhere from 30 to 70 times the amount of medicine that is usually needed.
And is it just a greater high, Dr. Friedmann? Is that what people are after, that they want the fentanyl? Or, what does it do?
The reason fentanyl, I think, has become popular is because it's easy to manufacture. The labs in Central and South America have figured out how to make it. Precursors are easily obtained from China and other places. Because it's so potent, you don't need a lot of it. So when you mix it in with the supposed heroin, you don't need a lot in order for a person to get the same effect. So if it's 50 times more powerful, which is what the estimates are, you need 1/50th the amount that you would have otherwise need in terms of bulk. So whereas in the past they used to have to carry huge bundles across the border or with mules, multiple condoms with heroin in it, now you can carry a very small amount in your pocket or in your suitcase, which is worth, millions and millions of dollars.
And typically, do you work with law enforcement at the hospital? Is this a typical scenario where, law enforcement would have been called in an overdose situation?
It's really unusual. So there are very strict privacy laws, both federal and state. Privacy laws that protect the confidentiality of patients, and it's only really in the context of a public health and public safety emergency that a physician like Dr. Beltran in this circumstance would break that confidence in order to save lives. And I think in this circumstance he really did. It's sort of an example that there was some very potent and probably poorly mixed opioid out on the street, which was predominantly fentanyl, and people were overdosing. A number of people died. And so in circumstances like that, physicians are able to do whatever is necessary, really, to protect the public health.
And do you think the users knew what they were taking? They knew that it was laced with fentanyl? Is it something that they desired, or is this something that they had no idea as they were using it?
It's hard to say. For those individual users, it would depend on whether they had familiarity, with that dealer and that particular strain. Sometimes there are stampings on bags that indicate you're getting the same substance, the same mixture that you had before. It's hard to speculate on that. But clearly what Dr. Friedmann said is accurate. This was poorly mixed, and it was so strong it was really lethal in a way that it's not intended to be. But to pick up on Dr. Friedmann's point on your question, Carolee, relative to the law enforcement versus public safety issue, it was a public health crisis that Dr. Beltran identified and then alerted law enforcement to step in and do something to save lives. And I think what's important to highlight is the fact that the people who reported to Baystate with overdoses were not arrested if they were obviously non-fatal overdoses. What we have in Massachusetts, which is important to highlight, I think, for the viewing public, is the Good Samaritan Law, which essentially protects people if they call for an overdose involving themselves or somebody else, and police and emergency services respond. People who are present, in the presence of heroin or other substances will not be arrested. It protects people to make sure that law enforcement and emergency services can respond and save lives. So here, the hospital performed no law enforcement function. It did not go into the realm of law enforcement. It just simply alerted that there was something very serious happening and lives were in danger, and then law enforcement, specifically my office and the state police assigned to my office, responded to interdict this, to stop this, and to save lives.
Now, the governor is asking for the legislature to change the state's statute on trafficking fentanyl. Is that something that you think will help with prosecution?
I think it will, and the governor and lieutenant governor have done a good job leading the charge on it. I think on the issue of addiction and the opiate crisis, from public campaigns around the stigma of addiction to attempting to change legislation, and I hope that the legislature will pick this up, strengthen the laws around fentanyl, because what we're realizing, both in the health sector as well as law enforcement, that fentanyl is tremendously lethal and dangerous, different than other substances, so it has to be treated that way. Public policy has to keep up with the realities on the street, and I am in support of strengthening the law around fentanyl, particularly traffickers. And it's consistent with how my office has approached the crisis, trying to help people who are suffering from addiction and trying to enforce the law as strictly as possible on those who are profiting from addiction.
And when we talk about people suffering from addiction, I mean, we have all just heard just so many sad cases, moms, dads, people that you would never expect that would have this problem. What could be your message to families who are going through this right now and struggling right now with a loved one?
Yeah, so prevention is a big key part of this, and a lot of it is education. There are multiple programs that are out there. I know that the DA has done some programs. Actually, I think it was Minnechaug High School, where there was basically a panel talking about this to both parents and students about the potential effects of this. So knowledge is a key component of that. The other part is talking about public policy is really just funding the mechanisms to help with addiction, because that really is going to be key, because if people continue down that path, and we're seeing it, many people are dying from this, and I think that's a very important thing for us to focus in on.
So Dr. Friedmann, can you talk a little bit about carfentanil and how powerful that is?
Well, so we talked before about how fentanyl is estimated to be about 50 times more powerful than morphine, heroin or morphine. So carfentanil is 50 to 100 times more powerful than fentanyl. So you can imagine how you only need a tiny little gram in order to precipitate an overdose in a human. And so the same problems we have when you have such a small amount and you have to measure it in such a precise way in order to get that very narrow window between somebody getting high and somebody dying. It's very challenging for somebody who's an amateur chemist, which is really what a lot of these folks are. Fortunately, in Massachusetts, we haven't seen a lot of it yet. There have been a couple sporadic cases in the last few years. There's more of it being seen in places like Ohio. And I think many of us are hoping that, that will stay out of our market.